Fantastic question here about how do doctors assess capacity. It's a very, sometimes it's very detailed and sometimes it's very broad, and it really depends on the context and the person and the relationship as well. So if someone has an established relationship with that patient, they'll understand whether or not they have capacity. And under Australian law, everyone is presumed to have capacity unless proven otherwise. And so essentially every doctor should presume that someone has capacity to make their own medical decisions. If we wanted to formally assess that for an individual case, what we really need to satisfy is 3 criteria. Is the patient able to absorb information, incorporate it into their decision-making process, and explain or express that decision to whoever's assessing it. So the way that I usually assess this is, in the first meeting, I usually talk about voluntary assisted dying and go through from start to finish, all about the process, the eligibility criteria, etc. And then along the way, I get the feeling for, or I'm looking for the patient adopting certain elements of what we've discussed and incorporating that into their decision-making process. And thirdly, at the end, I get them to explain some of the things that we've spoken about to me. So similarly, when I'm talking about chemotherapy, I say, now, did you understand that? Do you have any questions? What do you remember me telling you about the infection risk, and what do you need to do if your temperature is over 38, etc. So that's generally how we assess it. It can feel quite informal, but there is a structured process to it. Sometimes when we're not quite sure, we actually have to refer on for a formal capacity assessment that's usually done by a trained subspecialist. The waiting list for this can be large, although Dying with Dignity and the Voluntary Assisted Dying care navigators at Peter Mac have some links with people who are willing to provide this at short notice for those patients in need.